AM 1430 KRGI, 105.5 FM. Good morning, I'm Brian Gallagher. This is Community Connection. It's brought to you by Cornhusker Toyota Honda, Nebraska's only combined Toyota Honda dealership. We're going to get caught up on the latest news from Central District Health Department. Director Teresa Anderson is online visiting with us about some of the latest things that have come out in regards to our ongoing COVID situation. Teresa, good morning. It's good to have you here.
Good morning, Brian.
Let's talk about the most recent changes, the most recent news, and the most recent updates in regards to the potential of a booster.
Right. Okay, so what we know about the vaccine for COVID, whether it's J&J or Moderna or Pfizer, that they are all extremely effective in preventing serious illness, hospitalization, death. They're very highly effective, and that's what they were intended to do. What we're seeing is that some individuals are having what we call breakthrough infections, breakthrough cases. And what happens then is that in the breakthrough, the virus is not able to get deep into the respiratory system, like down to the lungs, but it can get up in the airways, like the nasal passages, and people will have some mild symptoms. And those symptoms, we'd like to collect samples on those individuals who think they're having a breakthrough case so that we can monitor that. But we know that those individuals are very, very unlikely to get sick enough to require hospitalization unless the folks, and the unless is what we need to talk about, is because folks who are what we call immunocompromised, moderately or severely immunocompromised, and I can explain that, those individuals need to have a third dose in order to get that effectiveness that I just described, while others get 2 doses.
The immunocompromise, is that something that perhaps their immune systems aren't as active or effective in stopping infections in?
That's exactly it. Some of these individuals have naturally occurring disease processes that cause them to be immunocompromised. Others are medically induced immunocompromised, meaning medications they take for ailments that they have causes their immune system to be weakened.
So those who are undergoing certain kinds of treatments and they've been told you need to be careful doing this, this, or this, they're the ones that also fall into that realm.
That's true. So if they've ever or they've been receiving active cancer treatment for tumors or cancers of the blood, if they've received an organ transplant or taking medication to suppress the immune system, if they've received a stem cell transplant within the last 2 years, and I think some people don't know what that is, which is good because that means you haven't had one. If you're moderately or severely have a condition that, as I said, is a naturally occurring condition that causes your immune system to have a deficiency, anyone who has an advanced or untreated HIV infection, and then this is the one that may be a little bit confusing, active treatment with high dose corticosteroids or other drugs that may suppress your immune response. So a lot of times people take medications, I'm going to say for like rheumatoid arthritis, maybe multiple sclerosis, ulcerative colitis. Those are just a few examples of conditions where people may be prescribed medications that control the symptoms, but in doing so, they reduce the body's ability to respond to infection.
Teresa Anderson is director of Central District Health Department in Grand Island, talking about some of the latest information that has been released or made available in regards to the potential of boosters that are available. So the booster shots, as I understand it, they're not specifically recommended or required for everyone that has been vaccinated. Those who maybe are a little more susceptible because of immune system deficiencies, they're the ones that are more likely to have the need?
Those are the ones that we want to give that third dose to first. But if I were a betting person, and I'm not, but if I were, I would say that the rest of us can look forward to a booster somewhere between 8 and 9, and I'm going to say third dose as opposed to booster because he's already had 2 doses. That third dose will probably be approved and we don't know that, but we think, that the United States has plenty of vaccine. They're continually doing research that gives us new information. This is a new variant that we're dealing with right now with the Delta variant. If I were to guess, I would say that the rest of us will be in line for that third dose sometime before Christmas, about the same time we're able to give doses to the age 5 to 12, who at this point haven't had any vaccines yet.
So are there recommended timelines then for waiting for the booster once you've had your first series of shots?
Okay, if you've had your first and second and you are immunocompromised, you need to wait at least 28 days to get that third dose. But for the rest of us, it's still out there yet to be decided. The FDA and the CDC will provide us with the guidance, and as soon as we have it, we'll make sure that people know. We know that vaccine is plentiful in Nebraska. We know that our vaccine, contrary to some other places, I think, is not going to expire. We're going to be able to use it all. In fact, weekly, we're receiving shipments or going to get vaccine from our partners across the state because we're seeing a lot of vaccine uptake right now. We're really excited that people are getting vaccinated, but the issue is, the situation is that, Brian, if you and I get vaccinated today for our first dose, then we get our second dose in 2 weeks. Or 4 weeks, depending on we do Pfizer or Moderna. It's still another 2 weeks before we're fully protected. The issue right now is we're seeing a rapid increase in hospitalizations across Nebraska, a rapid increase in the number of youth, a doubling of what we had last month as far as youth who are testing positive. So I guess to sum that all up, we're headed into another surge, and anybody who's not vaccinated needs to seek vaccination right now, first, second, or third dose for those immunocompromised folks.
The other thing I'm guessing then is that protection measures are also going to be recommended here.
Yeah, we've got one school in Grand Island Public Schools is requiring masks, and if you think about it, for our youth, we have maybe 5% of those kids who've been immunized. And if you think about sending a child into a room where we have a large community spread of virus, it's quite likely that they're going to pick it up. Now, how sick they get is the question, and we're hopeful, and we know that the majority of these kiddos don't get very sick. But we also know that there are instances where these kids end up in the hospital. And this is a big problem for us in this area because we do not have hospital capacity for pediatrics. So those kids are going to need to be transferred to Children's or Bryan, somewhere in Lincoln or Omaha. So we know that that's a problem. If we can continue to wear masks, our second school, GICC, started with masks today. That's really going to help protect those kids and in turn protect their parents and their grandparents and their neighbors. If we all would just mask up for a little while longer, and I would say a little while is probably the next month or two, we're going to be able to beat the virus. But right now, the virus has the advantage on us because we're failing to take the measures we need to take, which, as you mentioned, aside from vaccination, is wearing a mask, staying home when sick, social distancing whenever possible, and getting tested if you have symptoms.
I think human nature is rearing its ugly head a little bit. People are anxious to have this episode of life put behind us. It's obvious that we're not there yet. People are going, I don't want to, but that doesn't mean it isn't necessary.
So here's the thing, and we can't stick our heads in the sand and pretend that there is no virus or that it's not that bad. It will be bad. We've been told by the University of Nebraska Med Center this will not be good for us. We will have many cases. And we need to, as a community, we need to take the pressure off of the hospitals, off of the physicians' offices, the providers' offices, and we need to get back to normal. But we can't do it by pretending. We have to address the virus, stand up to it, and say, this is our world, virus. You go away, and I'm going to make you go away. I'm going to get the vaccine. I'm going to wear my mask. I'm going to protect my neighbor, my children, my parents, my community.
Well, I guess it's inevitable, and that's something that we all need to be prepared for and deal with. Be aware that the boosters are going to start being more and more part of our life, and more information is available from Central District Health Department. Therese Anderson, thanks for the update. Let's all figure out a way to finally get this thing put behind us.
We all just need to work together, Brian. We can do this. We can do it.
All right, Teresa, thanks, and stay safe.
Thanks for having me.
Good morning from AM 1430 KRGI, 105.5 FM.